lot of different cases. I had clients that were 13 years old all the way up to 65 years old. So they all had different presenting issues. Some of them were dealing with adjustment with different transitions in life, like going through divorce or unemployment, and others, like kids, were dealing with depression and PTSD. So I got to use different modalities that we learned in the program, and I felt like very supported all around because the physicians were there. My supervisor was behind me at all times, and I was able to just flourish on my skills, so it was a great experience.
It was helpful for me to get this experience because it really helped me to let other people know in the helping type of profession what social workers do. I was able to work with the client and helping them to establish goals, and my supervisor wasn't aware that social workers had that ability to go in and be short-term and focused on solutions and helping them to get to where they want to be. My patients were very happy just to have someone to listen to them and to understand that their physical health matters, but their mental health is just as important. And having someone there to listen to them and hear them out, that really just helped them to be more open in sharing how they were feeling, and it helped me to meet them where they were.
It surprised me that not everybody shares the same language as a social worker. And you have to recognize that not everybody has the same education background as you do. You don't have the same as a provider, and a provider doesn't have the same as you.
Working with other disciplines and learning their language and learning how to communicate is a really important skill so that you can advocate for your clients and better serve them and then better work together as a team.
I learned how to rely on my healthcare team strengths, and I learned more about their positions. I think they learned about social workers, all the skills that we had and how we can use that as in a clinical work.
It's so different from the training that I received, and I feel like it was, when I started in 2007, it was in more of a discharge planning role. And what I love about this program is that it's really bringing a set of true social work skills to the table. And I think this program and this type of training brings the social worker more into the fold as a true part of the team. It utilizes the entire skill set of the social worker as opposed to just one facet.
I worked with close to 45 clients, and I will say 95% of them were able to work throughout the year with me, and they didn't need to be escalated to higher level care. So working with a social worker in a clinic was the best for them. Yeah, it helped them a lot.
There's a lot of barriers for people in getting behavioral health treatment. So, a lot of people already have to go see their doctor. They could also get the help that they needed, and through the IBH program, that was a free service for patients. So that's really helpful because unfortunately a lot of people have to stop going to therapy because they don't have insurance or they aren't able to pay for it.
I felt like it gave patients a place to come where they knew that their needs were being met and that other people were kind of watching out for them. IBH Scholars learn how to advocate for themselves, how to advocate for your patients. You learn how to collaborate with medical personnel that you may have never worked with before, so pharmacists, doctors, nurses, the front staff, and you learn how to do wraparound care with patients and learn that teamwork is the best care for a patient, and working together really improves health outcomes.
You really learn the importance of interprofessional collaboration and working with people who are not social workers.
I think one of the best parts was watching her really become part of the team, which I think is something that you can't get just anywhere. So learning how to work with doctors, learning how to work with nurses, but then also advocating for yourself and really sort of carving out a role. I think one of the great things about being an IBH Scholar is the opportunity for creativity. So I saw you do a lot of things that you wouldn't have necessarily had the opportunity to do somewhere else because there would have been more in place when you arrived. So it was really cool to see you sort of innovate and put in place new systems and kind of craft that role to be what you thought it could be, which was, and now they're using that at the clinic, which is cool to hear too.
Being in that type of environment, it really just opens your mind to all of the possibilities that are open for social workers.